Hello everyone, my name is Xiangli Cheng. In this presentation, I want to show you the model about an auxiliary decision system for obesity. This presentation includes four parts. First part is about the background of obesity and the reason one chose this domain. In the second part, I will introduce some basic information about obesity. The third part is the main section, the modeling of domain. At last, I list the references of this assignment. Let's start with background and reason. As we all know, nowadays, with improving of living standard, there are more and more overweight or obese people around us. According to the WHO, the global obesity rate has almost doubled since 1980 and continues to rise each year. In 2016, over 600 million adults and almost 100 million children were obese, causing at least 3 million deaths annually. So obesity has become a global epidemic now, and the WHO called obesity a chronic disease in 2000. Here is a statistic made by the WHO. The 10 most obese countries on Earth in 2016. We can see from this diagram the number one is America, with the obesity rate excess 30%. But it's more interesting that New Zealand is the second most country. Specifically, in New Zealand, around 1 in 3 adults are overweight or obese. About 1 in 9 children are obese, 2 in 10 are overweight. So obesity is an extremely serious issue in New Zealand now, and this is why I chose this topic. In the second section, I will tell more about the obesity. Obesity is a medical condition involving an excessive amount of body fat. To a certain extent, it has a negative impact on health. Obesity has become a leading cause of death, with increasing risks in adults and children. As we have known that obesity is so common, so how do we make sure if we are obese? The most widely used method is the body mass index. Abbreviation is BMI. BMI is calculated by dividing your weight in kilograms by your height in meters squared. You are obese if your BMI is 30 or higher. In the right, the table is published by the WHO, which offers the classification of weight status according to BMI. We can see there are 4 obese levels, from class 1 to class 4. What are the causes of obesity? Everyone knows that the fundamental cause of obesity is eating too much and exercise too little. Other main reasons include pregnancy, environmental factors, genetics, medications, and family history, and so on. So what are the effects of obesity on our health? As we all know, excessive body weight is associated with various diseases and conditions. For example, high blood pressure, fatty liver disease, certain types of cancers, stroke disease, heart disease, diabetes, pregnancy problems, etc. As a result, obesity has been found to reduce life life expectancy. Now is modeling. Here is a mind map of modeling. At the center is the topic auxiliary decision making for obesity. The model consists of 4 parts: users, inputs, outputs, and events. Specifically, there are 4 kinds of users, including clinicians, nurses, patients, and software administrators. But here we just focus on the first 3 users. As for inputs, they are divided into basic information, history information, and medical information. Imagine when a patient comes to a clinic or hospital to check his or her weight condition. Nurses need to register his name, age, gender, date of birth, eating patterns, exercise habits information. Also need to measure and record his height, weight, blood pressure, and heart rate figures. Besides, the patient needs to provide his family's health history, weight history, and health history, this kind of information. Medical information includes his current medication conditions, stress level, sleep condition, and so on. After calculating, if his BMI is less than 30, showing that this patient's weight condition is normal, he needn't any treatment. Otherwise, clinicians or nurses will diagnose him and create or revise a prescription for the further treatment, such as non-drug therapy, like dietary change, more exercise, behavior change, weight loss medication, or surgery or other treatment, combined with the recommendation from a system. What benefits can the auxiliary decision system bring to New Zealand? There are 4 points. The first one is providing the most effective treatment during clinical assessment. Then reducing misdiagnosis rate among less experienced physicians. The third one is saving clinician time, since there are more and more obesities with the shortage of clinicians. Last one is improving obesity disease management, which can ensure information consistency. But there are still some limitations, like this domain is too big, so it's not easy to detail every type clearly. BMI does not distinguish muscle and fat, so some athletes' BMIs are also higher than 30, but they are healthy. At the beginning, there are not enough historical data to support the decision making. Last one is, in order to exchange data with other systems, the system needs to follow the SNO MEDCT rules. The last part is about references. This slide shows the reference list cited in this assignment. Thank you.